I'm Patrick Sanders, and I'm going to talk to you guys about attention deficit hyperactivity disorder, some of the myths and facts of ADHD by using a Prezi presentation. Countless theories exist about what causes attention deficit hyperactivity disorder in children. Some blame environmental factors, including diet. Others point to genetics or say that it's the product of factors while in the womb. Still others deny the condition entirely, blaming bad parenting. So what is true and what is myth about the causes of ADHD? One that just bewilders me is some blame sugar. Some say sugar is a cause of ADHD. Well, according to the National Institute of Mental Health, studies have been conducted on this very topic and found that there is no link to sugar. Researchers have studied behavior and learning capability with children who have had taken varying amounts of sugar substitutes, placebos, and found absolutely no link between sugar and ADHD. The first thing we're going to look at is the first myth is there is no medical condition as ADHD. Well, we know that this is wrong. ADHD is a medical disorder, not a condition of the child's will. A child with ADHD does not choose to misbehave. Even though they appear that they're doing it on purpose, it is not what they want to do. It is a medical disorder. The second myth is ADHD is caused by bad parenting. All the child needs is good discipline. And this is probably coming from the older generation where, well, if that child would get spanked, then he would not misbehave. Well, the fact is, ADHD is not caused by bad parenting. But parenting techniques can often improve some symptoms and make others worse. So a parent has to be very careful in what they do on how they discipline their child if they have ADHD. Is ADHD a life sentence? Are the children that have or been diagnosed with ADHD, are they going to have this for the rest of their life? Well, the fact is, although the ADHD symptoms usually continue into adulthood, the person learns ways to cope with the symptoms. People with ADHD have plenty of energy, are creative, and are often accomplish more than people who do not have the condition. So properly treated, the ADHD person, if they cope with it appropriately, they will have no problem with it whatsoever. Another myth. Having ADHD means a person is lazy or dumb. They may appear that way. People with very little patience may look at the ADHD person and think, well, that person is just lazy or dumb. The fact is, ADHD has nothing to do with the person's intellectual ability. Some highly intelligent people have ADHD. We listened to some videos in class, and there were some very intelligent people that was diagnosed with ADHD and they handled it appropriately. The second myth, the diagnosis of ADHD is confirmed if certain medicines have a positive effect on what seem to be symptoms of ADHD. Well, the fact is, children without ADHD respond to psychostimulants similarly to children with ADHD. A trial of medicine is not used to diagnose the condition. It can give them numerous false pretenses which they don't want. So, on the topic of medication, can medicine for ADHD, will it make a person seem drugged? Well, hopefully not. The fact is, properly adjusted medicine for ADHD sharpens a person's focus and increases his or her ability to control their behavior. Okay, so if they are using the correct medication and the correct doses, they will have control over their ADHD. Now, On the topic of medicines again, medicine prescriptions for ADHD have greatly increased in the past few years because the condition is being overdiagnosed. So, fact or myth? Well, the fact is ADHD is estimated to affect about 3 to 7% of all school-aged children in the United States. There is very little evidence to support claims that ADHD is overdiagnosed and that ADHD medicines are overprescribed. There's another myth. The psychostimulants are no longer useful after puberty. Well, the fact is, teens and adults with ADHD continue to benefit from the medicine treatment. So just because they become teens or adults doesn't mean you take them off the medication. Here's my favorite excuses. Children with ADHD are learning to use the condition as an excuse for their behavior. Well, the fact is, ADHD is a disability. Children with ADHD have to learn ways to deal with their symptoms, inattention, impulsivity, and hyperactivity that cause them to have difficulties in life. So, the children, they have to learn to deal with these things, okay? Can they use them as an excuse? Possibly, but if they learn to deal with them, then they should be just fine. Will children outgrow ADHD? The myth? Well, the fact is about 70% of the children with ADHD continue to have symptoms during their teen years, and about 50% have symptoms into childhood. So 50% of them will not outgrow ADHD. Parents can hope they will, but sometimes they will not. If a child has ADHD, he or she can always be diagnosed in the doctor's office. Is that a myth or a fact? Well, it's a myth. The fact is, a child may not always show symptoms of ADHD, especially in an unfamiliar setting. Evaluating a child's from one office observation may result in failure to recognize or even diagnose the symptoms. So you don't want that to happen. You want to make sure, okay, that you take your child in a very familiar setting where their symptoms can be diagnosed appropriately. In conclusion, untreated or inadequately treated ADHD syndrome often severely impairs learning, the family life, their education, work life, social interactions, and driving safely. Most of those with ADHD who receive adequate treatment, however, function quite well. Thank you.